Welcome everyone. I would like to show my progress so far in my PhD thesis called the Hungarian Hospital Clinical Pharmacist Position in the Healthcare System. My vision is that every ward should have a clinical pharmacist because we have a distinct knowledge in medication. And to support this vision, I would like to develop official clinical pharmacy services in Hungary. And I would like to show my 3 steps along the way. My 3 projects are listed below. And my first project is an investigation of the impact of the clinical pharmacist's work. It would be an international survey because clinical pharmacy services are not common in Central and Eastern Europe, and there is no official benchmarking system for this. This project will be a multi-step approach. First, I would like to have an international survey among clinical pharmacists to determine the position of the clinical pharmacists and their problems. The second step would be a systematic review of the provided clinical pharmacy services. And the third one, I would like to establish a registry about the applied measures to support the effectiveness of the clinical pharmacy services. We finalized the questionnaire. There will be 3 sections. The first section will be a descriptive information about the questionnaire questions, about the age, the educational background, and about the hospital. The second section will be a clinical pharmacist relationship with different healthcare workers. It would be a numerical rating scale based on their experience. And the third one will be about the clinical pharmacy services, what types units served, and what are the provided services. And now we are looking in the way how to distribute it. The second project is the combination of ulinastatin and the somatostatin and its effects. We submitted our manuscript in the last week, and we are waiting for the response of the target journal scientific reports. About the background, acute pancreatitis is the sudden inflammation of the pancreas. Its incidence rate ranges from 5 to 100 cases per 100,000 inhabitants. Its mortality highly depends on the severity. In severe cases, it can achieve 40%. However, there is no efficient pharmacon. Traditionally, somatostatin and its analog octreotide were used to treat acute pancreatitis. However, its controversial results show no significant results on patient outcomes, especially on mortality. However, in Asia, it's still used in the common practice as a basis of the acute pancreatitis treatment. And there is an emerging agent, ulinastatin, that is used additionally. Theoretically, somatostatin is used to decrease pancreatic juice, and ulinastatin is a trypsin inhibitor. It inhibits several pancreatic enzymes, for example, chymotrypsin, kallikrein, and so on. And this project aim is to investigate its effect on acute pancreatitis patients. We included all types of acute pancreatitis patients with every form of severity, and our main outcomes will be mortality, complication rates, and length of hospital stay. And our hypothesis is that this combination therapy is superior to the somatostatin analog monotherapy alone. After the abstract selection, we included 9 articles. For the meta-analysis, we included 8 articles. And one of the first outcomes would be the length of hospital stay. As you can see, all articles pointing at the same direction, that this combination therapy decreases the length of hospital stay by almost 10 days. However, we have high heterogeneity. We hypothesize that it is due to the factor that acute pancreatitis is a complicated disease. It can affect healthy and diseased individuals also. Therefore, their healthcare backgrounds is very different, and it is a high factor to this heterogeneity. And due to this length of hospital stay decreasement, it could be a huge huge factor in reducing the length of hospital stay because this combination therapy also reduces the complication rates of multiple organ dysfunction syndrome by 60%, acute kidney injury by 70%, acute respiratory distress syndrome by 70%, and shock by almost 50%. As you can see, in the first 3 outcomes, we had statistical significant results, and in the shock, we had only near significant results. However, we can state that it is all clinically significant because these are the 4 most common complication rates in acute pancreatitis. We investigated the mortality also. Its odds ratio is 0.5, so it's meaning that every second patient are saved to this because of this combination therapy. However, we had only near significant, statistically significant results. In conclusion, we can, in this investigation, we learned that this ulinastatin combination therapy significantly reduced the complication rates of MODS, ACI, and RDS. It shortened the length of hospital stay, it decreased the abdominal pain relief time, and it increased the symptom reduction rate. And we found decreasing trend in mortality and complication rate of shock. In summary, it is a possible new drug therapy for acute pancreatitis that wasn't available before, and this implication for research that we need more high-quality, well-designed randomized controlled trials, and we should see the most effective position in the treatment by conducting the health technology assessment. The strength of this investigation is that this is the first meta-analysis about this therapy, and we had rigorous methodology by following internationally accepted guidelines. The limitations were that a small number of trials and are located only in China. We have results from. We have some high heterogeneity, and the applied therapies and follow-ups times were different in most of the articles. And staying with acute pancreatitis patients, I would like to see the effect of proton pump inhibitors in this disease because proton pump inhibitors are one of the most overused medications. On admittance, 20% of the acute pancreatitis patients had prescribed some kind of proton pump inhibitors, and during the hospitalization, it were 70%. However, there are no acute pancreatitis guidelines that contain recommendation or avoidance of these proton pump inhibitors. In theory, PPIs reduce secretion of amylase pancreatic juice in an experimental model. Our aim is to investigate the effects of proton pump inhibitors in acute pancreatitis. We would like to compare this intervention with no PPIs or placebo. Our outcome would be adverse events, laboratory parameters change, and symptom reduction. Our hypothesis is that PPIs are not beneficial compared to placebo. The implication would be the decrease in adverse events because of not using PPIs. We finished the data extraction. We are waiting for the results from the statisticians. Meanwhile, I do the risk of bias assessment. Overview of my PhD thesis that I would like to summarize the current positions of the clinical pharmacists in Europe and to see the ulinastatin combination and the PPI's effects on acute pancreatitis patients. And to end my presentation, I would like to state that never stop asking questions. Thank you for your attention.
Thank you very much for this nice presentation. My question is regarding your first project. If I'm correct, all the articles came from China, right?
Yes.
And I mean, as an intensivist, I cannot imagine that you treat such a complex disease like acute pancreatitis with one drug, and you get such a a fantastic result. I mean, are you suspicious about the quality of these studies and the results?
Yes, we had several concerns. Yes. They stated that the standard of care was given every patient, the standard pain relief, the standard fasting or proper dietary management. And as you saw on the plot on the predictive intervals, there should be randomized control trials well designed to support these findings.
So these were not randomized clinical trials?
Yes,
they were.
They were.
So they claimed...
all of them were randomized clinical trials, yes. But there were several, the reporting was not sufficient or some kind of lack of information there were.
Yeah, we always worry about Chinese, that maybe we should worry about Hungarians too, or whoever. But what do you, I mean, you look so many of these papers now. I mean, are there other trypsin inhibitors which are actually used? Because this is, I mean, and why is this in China? So is this a kind of Chinese invention, this specific trypsin inhibitor? I mean, I'm innocent in the topic, so I don't know.
Yes, it's available only in Asia, China, India, and Japan. And I don't know the current reason why isn't this ulinastatin distributed worldwide. I looked into several wholesalers. It could be bought in Hungary too, and we can import it from Japan. It's 2 to 3 weeks. One ampule is $100 approximately. So if we would like to conduct clinical research, it could be feasible.
Okay, so that's realistic. I think that would be good to do the clinical, if I mean here, if possible.
Thank you for the presentation. I would like to ask if you, what do you think about how the cause of acute pancreatitis could influence the outcomes? Is it influencing very much, or it doesn't matter? Because, for example, a gallstone can cause like, I mean, with ERCP, you can take out the gallstone. However, with an alcoholic acute pancreatitis, you cannot take out the alcohol, of course.
Thank you. The articles, we included 8 articles in the meta-analysis, and out of these 8, I think 3 reported the etiology of the acute pancreatitis. So it's lack of reporting, and I couldn't state or have an impression what are the implications of the incidence or the cause of this pancreatitis.
Thank you for a good presentation. And I would like to know actually 2 questions. First, why did you choose this combination of medications? And if there's any other outcomes that you would like to study in your results, but you could not see them. And that's it. Thank you.
Okay. In the last year, I get contacted with the acute pancreatitis excellence group, and I would like to help acute pancreatitis patients because many young patients without any disease are suffering from acute pancreatitis, and there is no direct cure or direct treatment for this. And what I would like to see is current specific evidence that it decreases, for example, laboratory parameters. In the articles, the lack of reporting or the not sufficiently reported laboratory parameters would state that it is useful, not just clinically, but laboratorily too.